I think what's driving the gap is just really a lack of awareness. So for me, the reason that this campaign is so important is that we need to increase awareness, obviously. We need to improve the recognition, and then we need to talk about action, right? So I think one of the things that makes this so important is it's an opportunity to share. Again, as a mom, as a patient, and as a pediatric allergist, it's so important that people, number one, are able to recognize when you're in the middle of a scary situation. It can get very, things can get blurry, right? But I think here's where we really need to just recognize and act. So I think the gaps are really because of that lack of recognition. That's a really good question. So I think as far as the signs and symptoms, we generally talk in the like a situation where someone eats a known allergen or they're, let's say, stung by a stinging insect that they know they're allergic to, and they start with two body systems. That to keep it simple, it's two body systems. It might be generalized hives and difficulty breathing. It might be vomiting that they didn't have before and swelling. So two different body systems or one severe system, like difficulty breathing after eating one of your known allergens may be reason enough. So I always tell patients like talk to your primary care or your allergist about that. But recognizing and promptly using, right? And if there's ever a question about is it bad enough, what we want is to prevent it from being bad enough, right? So it's about early recognition, immediately treating with epinephrine, and then if you think about it, treat because there's a reason you're thinking about it. And I like to share that with my patients and with the parents because sometimes again you can get confused, but if you're thinking about it, there's a reason for it. So if you think it's necessary, treat and then seek medical care as appropriate. I think I always say it's hard to be a patient with food allergy, but I think it's harder to be a parent. It's harder to be a mom of kids with food allergy because you worry so much more about them. For me, I think it's just education is important. So it's learning, it's reviewing. The first time you hear something, it's one time at follow-up visits, for example, or when you have an opportunity to participate in an educational forum where you can learn about it. I think that's important. So learning about it and reviewing, because review is really important. I think that confidence is very subjective, but it does come with, practice a lot of times, whether it's practicing with a trainer, it might be, something like that, or thinking about scenarios. When might this be appropriate? I think because it's subjective, but absolutely like if you're in a situation where you're recognizing that this is anaphylaxis, the prompt and immediate treatment is epinephrine. I think the most common gaps that I see, honestly, is we can talk about it, but when you're in that particular situation, it's very overwhelming. So I've had parents say to me, I forgot what I was supposed to do. This is where I really do feel like AUVI-Q is helpful. There's audio cues, there's visual cues that can help kind of walk you through and remind you what are you supposed to be doing in the middle of that scary situation. I also am about empowerment. So being prepared and having at least carrying, two epinephrine at all times, having them available, that's being prepared. That's being able to control a situation which is otherwise very scary. I think it's important. This campaign is important because it's helping to increase awareness. And I already said, if we're able to recognize and then we're able to act, that saves lives. I think for families and for even patients themselves, I tell a lot of teenagers, you may think that like this is very overwhelming. You may be with a friend that needs you to save their life. And once you know how to do it and you've been properly trained and you know how to administer, you may be the hero. So I think that this is one of the reasons why the campaign is so important. It's just, again, recognition and knowing when to act and being confident about feeling like you can control the situation. just know that this is a whole community. The food allergy and anaphylaxis community is truly here for support. There's a lot of resources that are available on the AUVI-Q website, and there are resources available and support. I think that that's important. You're never alone. You always feel like you're alone. I can tell you sometimes, especially in the middle of a reaction, you're thinking, okay, it's all on me, but you're not alone. And there's a lot of good resources and support, and I encourage you to find out about those.